To this now, non-profit organization Health Quality Assessment released its 20th annual report on the quality of healthcare here in South Africa. The HQA releases its annual survey for healthcare participants to see their progress or otherwise in various areas of healthcare delivery. Now, the results also serve to assist in informing health policy. However, the data that the HQA actually gets for its report comes from private medical health schemes. About 8 million South Africans currently enjoy the benefits of private healthcare, while the rest have to endure the poorer public healthcare services. Clinical data analyst at Health Quality Assessment, Dr. Johann van Zyl, joins us now to further unpack this study. Doctor, great having you with us this afternoon. Welcome. So please enlighten us first on what are some of the key trends that are actually coming out from this latest HQA report.
Good afternoon and good afternoon, viewers. Yeah, the key trends are that, well, firstly, maybe to answer your question, just to look at the overall principle of HQA, it's really, as you said, a non-profit organization that was started in 2000, some 24 years ago, and the medical schemes really put this initiative together to track these quality indicators and to benchmark themselves against each other, and really with the self-review initiative in mind. So really what we have here is that medical schemes can measure themselves, and they can measure themselves against the rest of the industry. And the key trends that we're seeing in this year's report, which is really a continuation of trends that we've been seeing in the past, is that medical schemes, in terms of these quality indicators, have continuously been improving themselves, and some schemes more so than others. But overall, we've been seeing improving trends. Mm-hmm. The other main or other key finding that we see here is that there is still quite a bit of differentiation between medical schemes. In other words, some medical schemes performing better than others, and that just points toward some standardization issues, which is something that must be addressed in the run-up to universal health cover.
Very interesting indeed, Doctor. Now, there seems to be a lot of emphasis, though, on preventative healthcare measures in order to avoid disease. But is this actually proving effective? And in what ways, if you can elaborate, Doctor?
So preventative healthcare is extremely important in the sense that, number one wants to aim at earlier diagnoses and earlier intervention, because it's obviously cheaper to prevent something than to treat it, or a disease. It is also cheaper if one can intervene early, rather than later. And cancer is a good example of that. And many cancers have now become curative or curable rather. When they're diagnosed early, as opposed to when they're diagnosed later, when, the focus is more on preventative care. Mm-hmm. And then the second level of prevention is where we have established disease, people with chronic diseases, where one wants to monitor whether they are being treated and followed up regularly in order to avoid complications and comorbidities. And then in the process, avoid downstream costs, so-called downstream costs.
Now, interestingly enough, Doctor, the HQA actually sources, as I mentioned in my intro there, its data from private sector medical aids. And yet you say that the report can actually help inform a wide-ranging policy, maybe national policy, as well as boost the pending, of course, NHI. So how so when the data that you've drawn comes from the private sector and not the public sector, which has had a heavier burden in terms of patient care as well?
No, you're absolutely right, and there are many issues. The initiative here was to start in a sector, not necessarily the private sector per se, but to start in a sector where we have data available, and to learn from that. Because with all these industry-wide analytics and data collection and reporting, there are always many lessons to be learned. So that was really the initiative, is to start something where data is available and then to permeate that into the public sector. Also, So in that regard, HQA works closely with regulators like the Office of Healthcare Standards. The public sector or more public sector orientated regulators are certainly very much part of the HQA initiative. Mm-hmm. Just lastly, it does give us an indication of the way in which doctors practice and what benefits should be available, particularly again in a universal health cover environment. So really what this is about is that it's a learning experience, and the intention is to permeate this and to expand this into the public sector and help the public sector along the way in the process.
And looking into expansion, Doctor, which other areas then of significance did this survey look into? And what happens with the data that you've collected? Is it shared amongst the relevant authorities in order to better understand as well as prepare ahead of implementation of the various as well as different health-related projects and programs around the country?
Well, yes, to answer that last question first, regulatory stakeholders like Council for Medical Schemes, as I've said, the Office of Healthcare Standards, even the NHI office are part of the HQA processes. In fact, they participated in today's conference. So we're working hard to draw the regulators and the policymakers into the process and to allow them to participate in this learning experience. In terms of sharing of the information, very much so. We share the reports with those stakeholders. As I said, stakeholders like Council for Medical Schemes, Office of Healthcare Standards, and the like.
Doctor, thank you so much for your input this afternoon. That is Dr. Johann van Zyl, who is a clinical data analyst.